Hello, hello everyone. How are you today? Today has been a productive day. I thank God for that. So today I'm going to talk about oral sex and sexually transmitted infections, STI. But before then, have you followed me on my page, STI and Female Health Matters with Dr. Tinoade, STI and Female Health Matters with Dr. Tinoade on Facebook? That is my page. But on YouTube, you can subscribe to my channel, Dr. Tinoade, talking about sexually transmitted infections on YouTube. I'm on Instagram as well, Ajani Tinoade, and on TikTok. So I've been talking about menstruation, but I want to pause, say one or two things about STI and oral sex in 2 or 3 videos. Then I'll go back to talk about menstruation. So let's just talk about like an overview of oral sex and STI. So what we are trying to say is that there's something called oral sex. And so what is oral sex we're talking about? That is when you use your mouth. Anything in your mouth, maybe your lips, your tongue, your teeth, you use it to, or you lick another person to achieve sexual pleasure. You might lick a vagina, you might lick a penis, you might even lick the anus, actually. So, and they have different names. There are 3 major ones. If it is vaginal licking, we call that one cunnilingus. If it is penis, we call it fellatio. Some people call it blowjob. And if it is the anus, it's analingus. So those are the 3 main types of oral sex. And how do people get infected? Through different means. For example, now when people have sores, you have bruises in your mouth, you have a cut, you have wounds, like this is during dry season, your lips might be dry and cracking. Those things, they make it easier for all the bacterial viruses and viruses that are causing sexually transmitted infection actually to penetrate and enter into the body. And if you are somebody that's you are infected and you are giving oral sex to another person, definitely you can get that person infected. And if it is somebody that is infected that's giving you oral sex, you too can get infected. So it's like a two-way traffic kind of thing. And also, people have talked about menstruation. Ideally, HIV doesn't really enter through the mouth because there's an enzyme in the saliva that normally cleave off that virus. But even at that, if you have sores or wound in your mouth, there's tendency. And evidence has shown us that the more you have oral sex, the more or the higher the risk of getting infected with HIV. And also, if you lick a sore, you lick a wound, you can even lick what unknowingly. If you do that, you can get infected. And like I said, most of the sexually transmitted infection, most of them are asymptomatic. Like that means a lot of people have that. They don't even know. But if you have oral sex, even with that kind of person, you can get infected and you might even be the one that will now manifest the symptoms. If you lick a place now, maybe because when we have an infection, there's something called incubation period. From the time the bacteria or the viruses, the time they are entering the body, so the time you are seeing things that you can say, oh, this person has this problem, has this infection, we call it incubation period. So even if maybe a blister or a sore is about to erupt in that area and you lick that place, you might actually get infected with the virus that is causing the issue there, or even the bacteria. So what I'm just trying to say in essence is that it's easier to get infected with sexually transmitted infection by having oral sex. Another one is the menstruation. There's this blood-borne pathogens, where hepatitis B, hepatitis C. For example, if a woman is menstruating and that woman is infected with hepatitis A or B, and you lick that woman, definitely you can get infected as well. and have hepatitis A, especially if you have sore or wound in your mouth. And you know, during menstruation, after the menses, the blood might still be coming out a little bit. So it's possible to feel, oh, I'm done menstruating, somebody can lick this place. And the person will do that, and that person will get what? Infected. Then there's this pre-ejaculatory fluid. You know, especially for people that do this Velash shield, the blowjob. This pre-ejaculate, you might not even know when it's coming out. So in so doing, if you can also get infected because of the pre-ejaculatory fluid when you lick somebody's penis. So let me just talk about two main bacteria that we all know about causing STI. Let me talk about Neisseria gonorrhea. It's a bacteria causing gonorrhea. Gonorrhea is like a topic. Everybody has gonorrhea. But you see, gonorrhea, a lot of people have gonorrhea, they don't even know. Because most people are what? They are asymptomatic. So if you lick somebody with gonorrhea and the person is asymptomatic, you can have gonorrhea. And what we have, you just have sore throat, you have difficulty in swallowing, you can even have the discharge, because for people that are symptomatic, when they are infected with Neisseria gonorrhea, they have this yellowish, white, purulent discharge. So there can be that even around your throat, around your mouth. The second bacteria is Chlamydia trachomatis. It's another culprit for STI. And that one also is largely asymptomatic, especially in women. You might have that and you will not know. So if you lick that kind of woman, you can get infected. There are also viruses, but in my next video, I'm really going to talk about viruses, the issue of cancer and STI, the issue of what an STI. I'm going to talk about that in my other video. So if you have any question on oral sex and STI, you can email me at janitinoade talking about sexually transmitted infections 023@gmail.com, at janitinoade talking about sexually transmitted infections 023@gmail.com, or you call me on my business line, which is 0811774239. I will say that again, 0811774233. So you can ask me questions on oral sex. Of course, there are preventive measures which most people don't even like using. Why? Because it will limit the enjoyment, because it's like something that is putting a barrier between what you want to lick. I'm still going to talk about them in another video, but now what I'm just trying to say is that oral sex can cause sexually transmitted infection. And out of the three, actually, out of vaginal sex, oral sex, anal sex, oral sex is the safest, but that doesn't mean it doesn't cause STI. So what I'm saying, though, is the safest, that's the ratio, but people can get infected when they either lick somebody that is infected with STI, or they are infected and they are giving oral sex to another person. So it's a two-way traffic. People can get infected by them. So till another time, bye.